Hello, I'm Glenn W. Hunter, and with me is Dr. James George of Excel Physical Therapy and Wellness. And we're here to talk to you today about sciatica. Um, a lot of people have issues with their backs. It's part of the American experience. We're going to dive in today and speak directly to some of these challenges. Dr. George, you're ready to talk about bad backs right now?
Yes, of course. Yeah, I'm excited to share this information with people in Inland Empire and around this area. To help them. Many people are suffering with back pain and sciatica, and they don't know what to do.
So here we go. We're opening the door for the information for the Inland Empire and beyond. So when we think about sciatica, Dr. George, what is the difference between sciatica and just a good old-fashioned bad back?
Well, any pain which starts from your lower back but goes past your buttocks area, your glutei, we call it, yeah, and that is typically is termed as sciatica. But if you go dwell more into it, there are many reasons for somebody to develop pain going beyond the buttocks region, and we'll discuss further about that.
Well, I think that gets us started. So in that vein, what are the various causes or reasons for back pain and consequently sciatica?
Yes, people think that sciatica is, sciatic nerve, and so the problem is in the sciatic nerve. But many times it could be the problem coming from your lumbar discs or the nerve roots from the lower back. It could be joints, the lower back, which are referring pain down your leg, and it could be your sacroiliac joint. It could be problems with tight muscles, which are compressing on the nerve. Or tight ligaments, or even loose ligaments in the lower back, or in the sacroiliac joint. All these things can cause pain going down the leg. It's not only the problem is only with the sciatic nerve. There are many other reasons and causes for somebody to have pain going beyond the buttocks region. So that's why a trained doctor of physical therapy can evaluate and provide treatment for this issue.
I see. So, additionally, pregnancy is actually one of the causes of sciatica. With all the changes that are going on in a woman's body during pregnancy, how do you treat sciatica when, well, pregnancy is actually one of the triggers?
Yes, see, with pregnancy, as the baby is growing, the tummy is getting bigger, but the back arches more and more. So that causes compression of the your lumbar spine joints. And it also puts pressure on the disc. That could cause back pain, and it could cause sciatica as well. But also, see, as the baby is growing, the ligaments in your lower back loosen up to accommodate the baby, especially your sacroiliac joint. Now, as the ligaments are stretching, and that causes back pain as well. And many times it's caused because of tight muscles
Mhm.
and stiff joints. We can actually, with physical therapy, help treat that and decrease lower back pain with patients with who are pregnant.
Outstanding. You know, backs are tricky considering that structurally it keeps people standing erect, and the central nervous system runs right through the spinal cord. But what are some of the most common risks associated with ignoring what could potentially be sciatica?
See, yes, you're right. The central nervous system starts from your brain and goes through your spinal cord, and from there it comes out as peripheral nerves. We call it peripheral nervous system from the spinal cord. Now, the spinal cord could be compressed also when the disc is protruded or extruded completely. But your spinal cord ends at the level of your lumbar spine, the first lumbar spine. But beyond that, it's your peripheral nerves, right? So that could cause somebody to have issues with control of urination, control of going to passing stools, even with sexual function. So it is very important that if you notice any of these symptoms and problems of like spasticity or spasm in your legs, you need to immediately have it checked. Go and see your physician, or even now we have direct access in California. You can go see a physical therapist, and we are have doctorate degrees. We can evaluate you, and if you need any further consultation, if we cannot treat you, if it is a serious condition, we will refer you to a physician or an orthopedic surgeon to be taken care of.
Yeah, lots of layers of support right there. When you consider that a bad back could start from anything, really, from sleeping wrong to a bad mattress to, heck, overexerting yourself on a treadmill, what are some of the key triggers for a person to be aware of that leads them to calling you for help?
If you simple back pain, you wake up with because of a poor posture, you slept in a bad posture, you may have back pain. But if the back pain is not taken care of, it could eventually develop with the pain going down your legs, which the term is sciatica. But again, if you are a laborer, or your job involves lifting heavy weights and everything, and if you have lifted heavy weight with a wrong posture and with the poor body mechanics techniques, that could cause somebody to develop disc issues, and that could also cause sciatica. So as when you get back pain, it is a good idea to go and have it evaluated by a physical therapist, and we can if it doesn't involve any kind of severe neurological issue, we can provide physical therapy treatment, help you to go back to work or go back to your or whatever you love to do, your hobbies, or so it's all about taking care of your back. And when you notice back pain, uh, instead of trying to weather it out and popping a lot of pills to block your pain, that doesn't fix the stiffness or the physical problem in your lower back, because that will kind of numb your pain sensation. It is okay to take it for the over the counter just to take the edge of your pain, but that is not going to heal or treat that cause of your low back pain. You need to see a physical therapist or a trained professional, a physician who's trained in low back pain, or a chiropractor who's trained in low back pain. Looking into any of these professions, you need to go and get checked, get evaluated, and treated.
You talk about the importance of being checked, especially when you start getting that really biting back pain, that discomfort. And that made me think, when people experience back discomfort, they'll talk about back spasms. And I think that the question, it's almost too colloquial, that term. So what exactly is a back spasm, and what steps to heal that are triggered within you when you hear that term?
Back spasms happen when there is acute low back problem. Yesterday you lifted a heavy weight, you were doing some yard work, you bent over wrong. So what happens is you injured your muscles in your lower back, or maybe you actually overstretched your ligament in your lower back, or the joints, basically the joints in your lower back got stiff because of your repetitive movement. What happens is the body has a mechanism we call spinal reflex. So when there is pain sensation and the body wants to protect your back, so it causes a reflex to cause spasm in your lower back, so that it protects you from moving even further and injuring yourself more. So that is a good thing in a way. So again, that is a symptom. You need to go and see a professional who's trained in treating back pain, so that we have different modalities. We evaluate you and provide the correct modalities, and help you to decrease your lower back pain. Once your lower back pain is decreased and the tissues are healing, you won't feel the muscle spasm, because your body's not trying to protect your low back.
You know, in the spirit of the different modalities that you possess, you know, you've had a lot of success in getting rid of back pain. Specifically, how do people reach you when they find out that you're suffering from sciatica or other back pain?
Yes, you can reach us at 909-792-5050. We are at Excel Physical Therapy and Wellness in Redlands, California. You could also check out our website, excelrehabandwellness.com, and you can set up an appointment through the website. You could also visit our Google search. You can see 5-star reviews of our Excel Physical Therapy and Wellness, and you can send email through that as well. So you have different ways to contact us, and we are happy to help.
Once again, Dr. James George, Excel Physical Therapy and Wellness. And goodness, as the summer is rolling upon us and more activities going to be out in the marketplace, people are going to sometimes overexert themselves. Dr. George is where you want to go to ease those back issues and get you back active and enjoying Southern California living. Again, Dr. George, thank you.
Thank you.